I think what struck me about the dialogue was the degree of alignment amongst many people within the room for the need for a national pain strategy and also in particular to have an organization and powerful voice people or influential people, let's say, to be in leadership positions within that organization that might lead a national pain strategy. So there are many organizations within the space currently, but we really need to look at the different people from the different organizations, the structure of the different organizations. It may be that we'll need a new organization to carry on and lead this. That was a bit of an aha moment for me. So I think the challenge really in Canada is that we have a debilitating and common, very expensive public health issue that leads to a great deal of suffering. And that really what we should be charged with is reducing the suffering of patients who suffer with chronic pain, and indeed to prevent people from transitioning from acute to chronic pain. Really, I think currently there's great disparity in care across the country, and I think one of the things that we really need to do is to ensure that patients have access to the right care by the right people at the right time in the right place. Canada is a big, enormous country, and people in rural and remote communities do not have the same access to care as they do in the big inner city dwellings, and so for this reason, I believe that one of the key things that we need to do early on is engage provincial ministries to really develop standards and hold people accountable so that someone in Manitoba can have the same care as someone in, for example, BC and Ontario.